In a world-first surgical procedure, a SickKids patient has been treated for a condition called nutcracker syndrome. Linda Fedele spent months suffering from debilitating back pain before a SickKids urologist diagnosed her. And Dr. Armando Lorenzo and his team were able to develop a novel technique to help her. Nutcracker syndrome is a vascular compression disorder. It is extremely rare, and we're very pleased to have both Linda and the doctor in studio with us this morning. Welcome. Thank you so much for being here. Okay, I just called it a vascular compression disorder. I don't know what that means. Doctor, what is nutcracker syndrome?
The left kidney has to drain blood somewhere, and it goes through what is called the left renal vein. And in some patients, the left renal vein gets literally entrapped between two arteries, the aorta and the superior mesenteric artery. That creates high pressure in the renal vein, and that translates into horrible back pain and blood in the urine. And that's what Linda was experiencing.
Yeah, so Linda, tell me, how did you feel before the procedure?
Before the procedure, it felt like someone was stabbing me in the back constantly. The pain never went away, so it was always there.
And so you're presented with this extremely rare case. It was great that they were able to diagnose you, because back pain is back pain. It could just be a problem with your back. And your team, the team at SickKids, was able to diagnose Linda. And then what was the procedure like before you came up with this new novel approach? And tell me what the new approach is.
So that's part of the problem with nutcracker syndrome, is that, as you said, there are many causes of back pain and blood in the urine. So just to pick up on the very few that had this condition is what makes it extremely challenging. We actually feel that this may be underdiagnosed, that out there may be people with this, but they just don't know about it. So the way we treated this was by creating a new pathway for the blood to drain from the kidney. There's a vein that we all have called the gonadal vein that connects to the renal vein. So we made that vein into a two-way street, if you will, allowing the blood to come out of the kidney. And we did all that with a very small incision just in her lower abdomen. Before that, this would mean big surgery.
So I think we got a picture of what. Oh, yeah, there we go. This is amazing. So this had never been done before. So you and your team tell Linda, okay, here's what you got. Here's how we think we're going to fix it. We've never done this before. So, doctor, how were you feeling before this very first surgery? And Linda, knowing that it had never been done before, how did you feel about the prospect of being the first?
I was actually really nervous when the first time that we started talking about this. I couldn't even make a decision. I had to go home. And the next day we were calling, okay, we're going to do it. But I couldn't even make a decision the same day. I was so nervous.
Okay, and then you decided to go for it. How long did the procedure take?
I would say probably about 4 to 5 hours. So, Ben, this was a collaboration between a group of doctors, right? We had an interventional radiologist, we had a cardiothoracic surgeon, and my team and many other healthcare providers, all taking care of Linda and trying to help with the problem.
And Linda, how do you feel now?
Amazing. I haven't had pain since.
Zero pain?
Zero.
So go from debilitating pain to zero pain in a procedure that takes 4 hours. I'm guessing you're getting calls from doctors around the world wanting to know about this procedure now.
We get phone calls and interest in the procedure, and we're going to obviously try to present it to other doctors so they can reproduce this in many other parts of the world.
Well, Linda, we're so glad that this has changed your life for the better. Doctor, congratulations. We hope that your procedure helps people around the world. Congratulations to your team and to SickKids.
Thank you so much.
Thank you so much.